Hi, my name is Hayden Jacobs, and I'll be presenting public interest in cardiac arrest in the United States following Damar Hamlin's injury on Monday Night Football. I had the privilege of working alongside Macy Haight, Amy Nguyen, and Dr. Micah Hartwell on this project. So each year, there are approximately 356,000 reports of cardiac arrests that occur outside of a hospital. Of those, 90% result in death. There are also high incidence reports of inadequate CPR performance that corresponds to delayed identification of a true cardiac arrest, lack of CPR exposure, as well as application of proper CPR protocols. It's been shown that greater CPR awareness and training increases survival by threefold. In a study, only 19.7% of individuals stated that as a bystander they would perform CPR. On January 2nd, 2023, the cardiac arrest of Damar Hamlin, a 24-year-old NFL player, was reported on live television. The primary objective of our research was to quantify the degree of which Damar Hamlin's televised incident triggered public arrest in cardiopulmonary resuscitation, cardiac arrest, and commotio cordis, which was the suspected etiology of his arrest. We did this by obtaining daily search interest data from Google Trends related to the topics of cardiac arrest, CPR, and commotio cordis within the United States from October 12, 2022 to January 8, 2023. Search interest from Google Trends is reported as an RSI, relative search interest value, on a 0 to 100 scale, where 100 is the peak of search interest within the search timeframe. Then we constructed an autoregressive integrated moving algorithm model for each of the topics as if the injury to Damar Hamlin had not occurred, and then compared the forecasted model values as well as the actual data from Google Trends to determine the increase in RSI for each topic following the injury. So in the middle panel there, you can see that the largest peak in RSI for each of the three search topics occurred on January 3rd, 2023. Which was the day following Damar Hamlin's televised cardiac arrest. And in table 1, you can see we've compared the forecasted RSI values to the actual RSI values, and then summarized the percent difference for each of the topics there. So through Damar Hamlin's highly publicized cardiac arrest that occurred on television during an NFL game, public interest in cardiac arrest, commotio cordis, and cardiopulmonary resuscitation increased as evidenced by our results. Increased interest in these topics could advance interest in cardiac arrest prevention, as well as increase effectiveness of bystander interventions such as cardiopulmonary resuscitation. We believe that the momentum of this increased public interest could be capitalized on by public health entities, as well as by mass media outlets to discuss the importance of recognizing symptoms of cardiac arrest, as well as educating the public and performing effective bystander cardiopulmonary resuscitation attempts. Thank you.